Good afternoon, Richland County. We will begin in 1 minute.
Good afternoon, everyone. We're getting ready to get started. I am going to be welcoming everyone that's on the meeting today. Normally, we would do this in person, but we're doing it via Zoom because of safety reasons for COVID. First of all, I'd like to say we certainly in HR recognize the importance of health insurance to employees, retirees, applicants, as well as the Richland County as an employer. And that's one of the reasons that we're having these meetings. The other thing I'd like to add is that the county is making a substantial annual investment in health insurance. It's, I think, about $26 million a year. And we have had 7 impact meetings, and we'll tell you a little more about that later. But at the first meeting, Administrator Brown informed the committee that that amount was not a sustainable amount, $26 million in the long term. So primarily what we're here today is to share with you some information about the county's health insurance so you understand it, hopefully a little better. Also share with you some information regarding the county's financial status, and share with you some options, strategies, things the county is considering. Before I go any further, I would certainly like to acknowledge and recognize Administrator Brown for not only authorizing, but supporting this process to get input from all employees, retirees, before he makes a decision. I certainly, being an HR person, certainly appreciate that very much. I think that's a very good approach. And regardless to what decisions are made or what outcome, I hope as we go through this process, everyone will acknowledge that it is good to have input, even if you disagree. Having input before a decision is made is a good thing. In addition, HR is approaching this from the perspective of being transparent about the information that we're providing. There is a lot of information that is on our intranet. We will not be able to go over all that today. We had 7 meetings with the Impact Committee, and those meetings were about 2 hours each. So that's like roughly 14 hours. So obviously we're not going over all that. But all that information is on the internet. There are videos, there's copies of the presentations that were made, presentations made by various Cigna made a presentation, Gallagher made a presentation. There's information about PIBA. There's a lot of information about PIBA that's also on the on our intranet. It's important to keep in mind as we go through this that Richland County has a very, what insurance companies call a rich plan. That means rich in terms of the benefits. That has been something that we have been told by Carolina Care Plan Coventry, well, they're Aetna now, Aetna, Blue Cross Blue Shield, and Cigna. And when we've been with all these companies at some time in the past. And what each of them said is that the county's benefit for employees was or is better than the benefit that they offer to their employees. So that was Carolina Care Plan, Aetna, Blue Cross Blue Shield, and Cigna have all told us that. So it's not just my opinion. That's from 4 different competing companies have all said that. Another thing that's important to keep in mind is that we have a lot of employees that have chronic illnesses that impacts greatly on the county's claims. We'll talk more about that later. But just to give you an example, over the years we've been with Cigna, I think we're roughly at about $9 million exceeding, where claims are exceeding the amount of premiums that we have paid to Cigna over the years we've been with them. So to put it another way, they have taken about a $9 million loss. Basically, healthcare is paid for, or group healthcare is paid for in about 3 primary ways. The employees pay some of the premiums, the county as the employer pays some of the premiums, and what employees pay out of pockets, co-pays, deductibles, co-insurance, things like that. Currently, the county, I think all of you know, but if you don't, we have our employee health insurance with Cigna. We have our early retiree insurance with Cigna. Early retirees are those retirees that are less than 65. We have our Medicare employees, Medicare Advantage through Humana, and that's retirees rather that are 65 or older or have Medicare Part A and Part B. Today's presentation is going to be done jointly by HR and administration. And before I hand it over to Ms. Walker, I would like to thank the Impact Committee members. They attended, many of them attended all 7 of the meetings, 2 hours each. They provided a lot of input. They disagreed with a lot of things. I think they represented employees well. They asked a lot of questions, and they were very, very engaged, I would say, throughout the process. Would also like to thank IT for helping us present this information in this manner, especially Ms. Angela Weathersby has really almost had an office over here helping us get things set up. Maybe we needed that much help, Angela. But anyway, with all seriousness, she has been really marvelous in helping us get this set up. We wouldn't have done it literally without her. So with all seriousness, we do. She's always helpful, but she's been extremely helpful in this case. And last thing, again, before I turn it over to Ms. Walker, I would like again to thank Administrator Brown for the approach that he has taken. I'll say something, I don't know if he knows this, but I was going to a meeting with him. This was sometime last year, and we were talking about health insurance, and we had identified, well, I should say Ms. Thomas had identified, I think, about a method which the county could save about $10 million. And we were talking about that. And I was kind of prepared to ask Mr. Brown if he would have a process where employees gave input prior to making a change, if a change was going to be made. And I think we were like early in the meeting, and I think Mr. Brown said something like, well, I'm just going to cut this short. I'm not going to make a change like this without having input from employees. So I didn't get to make my speech. But anyway, the bottom line is, with all seriousness, I really appreciate the approach Administrator Brown is taking in terms of engaging employees, giving HR an opportunity to get input from employees before a decision is made. Having said that, I'd like to turn it over to Ms. Trina Walker, who will do the first part of the presentation. Thank you.
Thank you, Mr. Hannah, for your welcome to the group. Good afternoon, everyone. Thank you all for taking an hour or so out of your busy schedules to join us for the presentation. We're glad that you were able to join us. So thank you in advance. We also would like for you all to know that this meeting will be recorded and will be available to everyone on the intranet prior to Monday. So just know that all of this, just in case you may be taking notes, will be available to you, video recording on the intranet by Monday. Okay? Just so you have an idea of what we are expecting to cover today, of course, thank you, Mr. Hannah, for the welcome. Additionally, we will cover some data, some material in a presentation style to give you all some of the ground or data of Richland County as it relates to healthcare. And then the most important part, the main purpose for this meeting is giving you all the opportunity to provide your comments and questions. We are asking, if you don't mind, to hold your questions and comments to the end so that we can dedicate a set period of time for your questions and comments to give us an opportunity to review the presentation so that you have all the data at hand. So that is what we are looking to cover today during this meeting. Okay. As you all know, as you all may know, Project I.M.P.A.C.T started with the creation of a committee. The Human Resource Department partnered with department directors and elected and appointed officials. We partnered with them to ask them to designate persons that they felt would serve their departments as being a liaison on the committee to be a part of this committee. We also did not want to leave out our retirees, so we sent out communications to them and asked for their participation as well. Of those that were on the committee, 25 were active employees, 15 were retirees, and the total, there were 18 different departments represented in the meeting. And again, we hosted 7 meetings consecutively that these committee members attended. As you can see, just as a quick glance, you can see the meeting topics. Of course, a lot of details were shared and gone over during these meetings, but the first meeting started with the overview from leadership, and then we started from kind of like the ground and provided like the basics or the ABCs of benefits to give those who are on the committee the basic information to be able to build off of. The Gallagher team presented information to the committee. In the third meeting, the fourth meeting, Cigna presented information, and then of course Humana, which is our vendor for our over 65 retiree, provided information. And then meeting 6, we kind of brought all that together to come up with cost containment strategies that companies often consider when they are looking at ways to mold cost. All right. And again, this presentation, as Mr. Hannah said earlier, is only a small fraction of the information that was presented during our committee meetings. This information, the committee meeting information, is available on the internet. The notes, the recordings, all that information is on the internet if you choose to view this information. We're going to start by first presenting the information that was shared from the survey. The Human Resource Department received 450 responses to our survey that we initiated a couple of weeks ago. Of those who responded, 396 identified themselves as employees. 39 identified themselves as retirees, and 15 did not respond to that question. 39 of the 33 departments did participate in this particular survey. In the bottom chart, you can see one of the questions asked about the years of service with Richland County government. About 25%, as you could see, of our respondents are those employees who have been with the county 0 to 5 years. Just a quick overview of that information. You can see the breakdown based on the years of service that employees have been with Richland County government. All right. Just so that you know, the survey was a total of 23 questions. Again, our main purpose for this meeting is to provide you all with a space to be able to ask your questions, make comments, to share your comments with us so that HR and the administration department understands your view. So I will not be covering every single question that was presented in the survey. However, the survey results will be posted to the intranet. All of the questions and the responses will be available. So only during this presentation, I will only be covering just a few of them, just to give you an idea of how employees responded, the 450, the employees and retirees responded to the survey. Question 2, if currently enrolled, which health plan are you enrolled in? As you can see, we had someone or employees to respond that were covered in each of the 4 plans. Again, that's the Choice Plan, 71 employees, the Standard Plan, 166, the Buy-Up Plan, 180, and Humana, excuse me, again, which is our Medicare Advantage plan for our over 65 retirees, 16, and we even had 10 employees to respond that currently are not enrolled in our health plan. Question 3, if currently enrolled, which tier of coverage do you have? For those who have retiree or employee only, there was 284. For those who have spouse on their coverage, 30. For those who have children on their coverage, 86. And for those who have full family coverage, there were 32. And again, we had 18 that did not provide a response to that particular question. All right, for question 6, I am satisfied with Richland County government's health insurance offering. Again, you can see that there was a wide range of responses given the 4 options. 105 strongly agreed, 239 agreed, there were 76 that disagreed, and 26 that strongly disagreed. And again, we had 4 that provided no response to that question. All right, question 8. Richland County health insurance costs are, we have not expensive, reasonable, and too expensive. And you would see that 55 said not expensive, 292 said reasonable, we had 100 to say too expensive, and we had 3 to provide no response to that question. Okay, we're gonna jump to question 10. Do you think employees and retirees should pay more if they have 2 or more children on health insurance? Again, this is asking whether or not you think that employees should have to pay per child. 184 said yes, 248 said no, and there were 18 that provided no response to the question. All right, we're gonna jump to question 17. I participate in Richland County government's wellness incentive program through Cigna. We had 313 to say yes, we had 70 to say no, and 67 provided no response. To question 20, I have an opportunity to elect health insurance coverage under someone else, but choose Richland County's government plan. We had 59 to say yes, we had 340 to say no, and we had 51 that provided no response to the question. Questions 21 through 23 were open-ended questions. So all responses have been captured and will be available as well to employees and retirees on the intranet for employees and then through a secured site for retirees. The complete report of unedited responses will be provided to County Administrator Brown and Assistant County Administrator Lori Thomas for their review as well. During our comparison, Richland County compared our plan with those with neighboring counties and cities. We compared our plan with Lexington County as well as Mecklenburg County and the city of Charlotte. Overall, it was determined that our plan shows that we still have a rich plan and our premiums are reasonably priced. Another comparison we made was with South Carolina Retirement System, what most of us know as the state health plan. It is the largest plan in South Carolina, covering over 268 employees, and the employees are included in state state agency employees, higher education, school districts. The PIPA plan covers 34 of the 46 counties and cities and towns in these states, which includes the city of Columbia. All right. A lot of times the Human Resource Department is asked, have we gone out to market? Have we considered doing a RFP to compare our plan with others? And we wanted to show this information to show you that on the left-hand side, we went out for a request for proposal and or did a external market review in 2001, 2003, 2008 and 11, 14, 17, 19, and 21. So as you see, we do go out to compare our plans and premiums with others to make sure that we're offering not only good coverage, but competitive prices as well. Also, if many of you have been like me, I've been here with the county right at 5 years, so I did not know the history of where we had been as far as carrier history. Just to provide you with some history, Richland County was with Carolina Care Plan from 2008 and prior. We were then with Blue Cross and Blue Shield of South Carolina from 2009 to 2011. We were with WellPath from 2011 to 2013, Coventry 2013 to 14, and we started our relationship with Cigna in 2014. So this provides you a little history as far as what carriers we have partnered with for healthcare concerns. We also wanted to share with employees, because we know that you all don't work with health insurance every day, we wanted to provide you information on how premiums are determined by the provider. So that would be your Cignas, your Blue Cross and Blue Shield, et cetera. There are a number of factors that underwriters consider when quoting premiums for health insurance. First, they will think about they will consider the number of employees and dependents and retirees that's covered on the plan. Additionally, they consider the average age of employees and retirees on the plan. When the average age of employees are higher, underwriters anticipate more care and services will be needed. That is something that they include in the little calculation that they do for premium. Additionally, plan experience and utilization is also taken into account. This would include our claim history. Also, the medical loss ratio. The medical loss ratio is the percentage of premium dollars collected to claim dollars paid. Okay, Mr. Hanna kind of mentioned it a little earlier. Just so you know, last year, Richland County's medical loss ratio was 100.7%. That means Richland County spent more as far as our claim dollars than we provided to Cigna in premiums. To date, since our relationship with Cigna in 2014, Richland County claims are $9.7 million more than the premiums that we've paid Cigna. So this is our cumulative loss since we've been with Cigna, just to provide you all with the context of our relationship with Cigna and the dollars as far as claims and premiums are concerned. Additionally, the underwriters consider the benefits and the services built in the plan. As with anything else, you go get something to eat, you add something to your meal, everything that you add costs more. So this is also a factor in determining the premiums for health insurance. Because this was one of the items listed on the survey, we thought we would just use this one as merely an example. Adding bariatric surgery to our plan, Cigna informed us that it would cost us 5 to 7% more to add this one benefit to our plan. This would be an approximately $1.2 to $1.7 million more on top of our current premiums. So this just gives you an idea of how this plays a part in how premiums are determined by health insurance companies. So the more you add to the plan or take away from the plan affects the premium that the company will quote, okay? And of course, administrative costs are also included in premium determination, all right? Based off of our current data that we have at this point, it is highly likely that the current plans that Richland County offers without modifications would require premium increases for 2023. Okay? The next couple of slides will be data that Cigna provided to us regarding our claim experience as it relates to Richland County only. We wanted to provide the healthcare conditions, and these are conditions that are treated every month, and the top cost drivers. Cigna provided to us that based on our population of members, 50% of our members have chronic conditions. This population of members are driving 83% of our total spend. Okay, so this is good information to know as it relates to our conditions and how they impact our costs. All right, the top 5 conditions that are driving our costs will be those of hypertension, obesity, metabolic and immune disorders, diabetes, and psychiatric conditions. And you can see the corresponding percentages for each one of those conditions. They also provided the health engagement percentages for our members. It is good to know that at least we have 53% of our members that are engaged in their health in some fashion, all right? 47% are engaged in getting their preventative care exams. 70% of these persons are persons with chronic conditions, all right? So these are some good information for us to know when we're looking at our plan as a whole. And typically with chronic conditions, they are treated with medication. So it's not particularly surprising to us that our pharmacy spend is above the norm. Because again, remember in our previous slide, we stated that 50% of our members have chronic conditions that they are living with. So as you can see in the first chart, in all of the areas that Cigna has been tracking, we are above the trend in all of those areas. All right, in our overall prescription trend, we are up by 16.2%. All right, and then we look at by our top therapeutic classes, by spend, our classes, you would see that most of the areas, the trends have increased. All right, and then you would see the therapeutic class compared to the condition for each one of those. And then when you consider the medication adherence, you would see that Richland County is below the norm in some cases, those identified with the red, and then we are above, which is a good thing, the norm, which are those with the green numbers to the left. And then we are spot on when it comes to cholesterol as far as our comparison, our current plan compliance comparison with the norm. All right. Now, of course, with our plans that are offered through Cigna, we have our active employee population that is offered our Cigna plan, as well as we offer the standard and the buy-up plan to our retirees. So we wanted to kind of slice the data to give you an idea of if we were to present them separately, how the two would be running as far as it relates to our active employees and our retirees. This current slide provides you the information with active employees only that's on our Cigna plan, all right? The first number tells us that 13.8% our trend has increased for our active employees. For the pharmacy spend, it has increased 20.1%. And then the average total trend is an increase of 15.2. Employees represent 65% of the total population and 80% of the spend. All right. Employees incurred 21% higher costs than their spouses. And then they also provided, again, the top conditions by spend. And you see those 4 listed. And then they also provided the top drugs by volume. And they listed those conditions that are associated with the drugs. So the current medical loss ratio for active employees only is 84%. All right, now let's look at the retiree side. Our medical spend increased 10.1% for our retirees. The pharmacy trend decreased 7.8%, and the average total trend was an increase of 3.4%. And then again, you see the top conditions and the top drugs for our retirees. And the current medical loss ratio just for our retirees is 137%. So that gives you a little data about how our plans stand and some of our cost drivers and conditions as it relates to our trends. Now I will share the floor with Assistant Account Administrator, Ms. Lori Thomas, to take us through the second part of this presentation. Thank you.
Trina, thank you for that great information, and thanks everyone for attending this afternoon. We appreciate this. I want to talk a little bit about cost containment strategies that were kicked around in every market and also among the group as we met with the impact committees. Let me start by saying that just because we're with Cigna doesn't mean that our plans with Cigna would not be able to be changed. Plan design is one way that you can control costs. And as Trina has pointed out continuously here, our plans are very, very rich to the point that the spend that we have based upon those plans is what is making them somewhat unsustainable. So things that we could do to make, or that might be considered to make our plan more affordable would be to change the benefits. At one time last year, there was consideration from Sigma to maintain a 0 increase to actually eliminate our buy-up plan, which means we wouldn't have access to that any longer. So those people on that plan would not be able to access those care. You would then find yourself either in the standard plan that we have, which is a 70-30 for major medical, or in the choice plan. Another is to increase copays, to increase co-insurance, which means going from an 80-20 to a 70-30, which is what our standard plan, or some smaller participatory amount, or some larger participatory amount for the employee. Looking at consumer-directed healthcare, this is your high deductible plans, which we have the choice plan currently, but those are very prominent options for the market to actually take control of healthcare in the private industry and also in public industry. More cost sharing, that's basically the copays and the co-insurance. Actually, your employer pays would pay the same or less, and the employee would pay more for those costs, for those services. Another consideration is deductible increases. Right now, our buy-up plan has a $500 deductible. Our standard plan has a $1,000 deductible. Those are very rich plans in the market currently. Changing dependent coverage eligibility. According to the federal law, there isn't the ability to change coverage eligibility for dependents under age 26, but that we may be able to look at coverage changes for people like spouses through a spousal surcharge if they have access to coverage somewhere else, but choose to be on the county's plans. You'll also find that line item listed in the other column to your right. Dependent verification. This is a norm in the market. That basically means that everybody that's on our plan is on our plan in accordance with our plan contract, which means that you have to be an eligible dependent. Change our funding type, going from a self-funded plan to or a fully insured plan. Currently, we are a fully insured plan, and that means we pay Cigna, and Cigna pays all of our claims regardless of the cost. Well, we already know that the amount that we've paid Cigna over the years is $9.7 million less than what it's cost for our claims. So the obvious thing there is that at some point in time, our premiums are going to have to go up again. And when that does, a decision is going to have to be made as to how those increases are divvied up. Right now, for every dollar of health care coverage the county pays that is paid by the county, both the employee and the employer portion, the county pays 87 cents of that. So the employee is only paying 13 cents of their premium on average, not in total, but on average. So that means if you see a 5% increase, we have to decide how are we going to be able to absorb that increase? And is it viable for the employee to pay an equal part as the county or some other distribution? There's been conversations related to an on-site wellness center. I've been involved in one of these before. They are great benefits for employees because it can offer care to employees outside of the health insurance system. It's a great benefit. It can sometimes help to control costs, but it can't make the kinds of impacts that we might need to be considering to ensure that this plan is sustainable long-term. Increasing out-of-pocket maximums is a possibility. Currently, ours are relatively low. Changing premiums back to pay by participant. In other words, the number of people that you cover. Looking to change our prescription drug benefits. That's a definite option, especially given that actually our prescription drugs are one of the largest drivers of our plan. Retiree coverage and eligibility. Not saying there's going to be a change there, just saying that that's something that was brought up and discussed. We've talked about spouse surcharges. Telehealth and telemedicine is a new driver in the market that tends to drive down costs, but there are times when you do need to see a physician, and we would never want people to feel like they couldn't do that. A tobacco surcharge, this is quite common, and as a matter of fact, when you looked at our survey, 70% of those people surveyed thought that tobacco users should pay more for their health insurance than those who are not tobacco users because they are more likely to have health issues. And then, of course, wellness incentives. We currently have a wellness program, but it is participatory. Wellness incentives may be restructured in some way, shape, or form to become outcomes-based, but that does require a hands-on approach of either medical or other groups to manage that. We can go to the next slide. So we've told you that over the last year, we have actually gone out to market and actively sought claim or quotes from anybody in the health industry who is a good partner to actually quote our business. Last year, when we went to market, we actually had one carrier that would not bid Richland County. We did receive bids from Aetna, we received bids from Blue Cross Blue Shield, and we received bids from Cigna. The other carrier was not willing to take on our risk because our rate of loss is much higher than what has been able to be covered by the premium, so they did not feel that they could compete. We did reach out to the state employee health plan to ask if we were a viable candidate for their coverage. They did respond in affirmative. However, that plan is an all or none plan. If we were to choose to go to the employee health benefits plan as a county, there would be no other options for coverage outside of that. So you would not be able to choose another company. They are the single largest benefit plan in the state, probably in the region. And for that reason, they can pretty much tell you how your employees and your coverages can be aligned. So as you will see to the left-hand side, our current Cigna plans are outlined. To the right-hand side is the PIBA plans. There are only 2 plans offered by PIBA. That is a standard plan. However, it does offer an 80-20 coverage like our buy-up plan does, but it does have what we refer to in the industry as a hard deductible. In other words, you have to pay that deductible before your co-insurance kicks in. As we looked at these, I'll be pointing out some options that we've looked at related to those. They also offer a high deductible health plan that you would see there. They do have higher deductibles than our current high deductible health plan. And in addition, what is not shown here is the state health plan has access to a plan to be a supplement to TRICARE, which may be a benefit for those individuals on our plan who are covered by military benefits as well. So this is going to be on 2 pages, and I'm not going to spend a whole lot of time on it. Number one, because it's very small. And number two, because I really believe that people need to take a look at this and sort of investigate it on their own. So if you go to the next 2 slides, please, Trina. So my next slide here, I've actually taken what our current employee and employer rates are for our Cigna plans and compared those to the I.M.P.A.C.T plan, which is the state employee health plan. And I've also indicated on there what potential employee savings are from these premiums. In most cases, the employee would see premiums that are less than those of our Cigna plans. For those where they are not less, we have looked into an option that if this were a recommendation that would move forward to council, that we would be able to cover those losses and no one would pay a higher premium in the coming year than they are currently. Under the Cigna plan, I certainly cannot say that at this point in time. So as you see, the first group of coverages there are for your buy-up plan. The next group is your standard plan. And the last group is our choice plan. The far right-hand column shows the annual employee savings on premiums, not the county savings, but the annual county employee savings by premium from premium. So this is actually money that would go home in the pockets of our employees as a result of this change. Again, for those 3 groups where we are looking at a slight increase, we were looking at ways to be able to cover those amounts. The next slide, please. Now to talk about what this means in totality. The total plan, on this slide, I'm comparing the total plan cost comparison with Cigna and with I.M.P.A.C.T for both the county, for employees and retirees, and what that means. Under the current enrollment tab there, you see that the employer current cost for our current enrollment, which is about 20% less than full employment. We have about 20% of our positions vacant currently. And that's pretty much a market trend as well. But our current cost for health insurance only, this does not include your vision, your dental, your life, or any other policies that the county supplements. That cost is $21.2 million. The employee cost is $2.89 million. If the county were to transition to I.M.P.A.C.T as an option, the county would, and at the same time, ensure that no employee saw a premium increase and that the county were to assist with the deductibles associated with the standard plan, the total cost for the county would be $12.97 million. The total cost for employees would be $2.2 million. So those are some significant savings. If you look at the far right-hand side, that's $8.2 million for the county for total contributions and $619,000 for employee and retiree contributions. The average cost of the current enrollment is the middle column in this chart. This shows that for retirees under 65, the county currently pays an average of $14,600 annually. The employee pays just over $2,000, or the retiree pays just over $2,000. For retirees over 65, the county pays $2,200 approximately, and the retirees pay approximately $373. This is based on current enrollment. So some of these people may have dependents and other such on their plans. The active employees currently, the average cost is $11,800 for the county. For the employees, the average cost is $1,593. That's, if we were to shift to a I.M.P.A.C.T model, you can see those changes there. They drop significantly. The next thing to talk about is what full enrollment looks like. So if we filled every position within the county, which we all know that we need help and we do need to fill these positions, our current annual medical spend would be $25.4 million. This is not an amount that we have budgeted, so we would have to increase our budget. We currently haven't done that because at present, we don't feel that we can actually actually hire all the individuals in the market that we have. The current employee cost for the full complement would be $3.4 million. Whereas at full employment with PIBA, we would be at $15.5 million, including maintaining premiums and assisting with deductibles, and $2.7 million for employees. So the savings for the county would be an estimated $8.2 million under current circumstances in the first year. These are funds that could be used for other employee benefits, such as compensation and other related services that may be needed. Next slide, please. This slide actually gives you some information on the PIBA plan design, and there are some significant differences. This was prepared by Gallagher. I will let everyone sort of read them on their own in the interest of time, but it does say here that standard plans have a deductible before getting office visits. Again, I'm pointing out here that the county has actually looked at scenarios to cover that deductible on that standard plan. So if we can go to the next slide, please. So here I've put together a scenario of just this, in simple layman terms, what the pros and the cons of each plan are. Again, there is lots of information out on the employee internet, and we encourage you to go there and to digest it. And if you have any questions, reach out to HR or to anybody in administration, and we'll be happy to have a conversation related to those things about you. But from a pro side, there's financial stability in the state employee health plan. The rate increases for employers have been moderate over the years, and there has not been an increase in the standard plan rates since Obamacare was implemented, and I believe that was in 2014, if I'm not mistaken, or 15. The buying power is what makes the premiums stay relatively cost efficient. The state health plan covers over 268,000 contracts. That means employees. So there are a lot more lives covered. So if you cover you and your spouse, in addition to those 268,000, you add on the spouse or your dependents. And it also covers 34 counties, many state and local governments, and higher education, school districts, and all of your state employees. So for that, doctors and hospitals and want to do business with that group because it brings to them a group of patients. So the network is very wide. It's competitive with governments for other recruiting efforts. In other words, we would not be trying to compete with lower salaries or higher benefits or or lower benefits and higher salaries. It would put us on an even playing field there. There's cost containment for office visits when you're using the patient-centered home there. Under PIBA, there's a thing called I.M.P.A.C.T, which gives you assistance with those co-payments and things that are listed in their plan. I.M.P.A.C.T gives an alternative for cost savings for employees who participate in that program. You don't have to, but you can. And then it reduces costs to make it possible to fund other things. The county only has one pot of money, and that is the revenue that we gain from taxpayers and fees and other things. Those are not like in private industry where you can just go out and change your price. Those are controlled by legislative action or by governing body action. And that opinion in the community would be one that we would have to decide whether they're amenable to rate increases or to tax increases to fund health insurance. Now for some of the cons. There's no claims data there. If we would become a member of this group, we would not be able to have access to our own individual claims data. Now, right now, we do get aggregate claims data, but we don't get actual individual claims data because we don't own it. We actually buy into an insurance plan. We would have to make a 4-year commitment to stay in the plan. That is a requirement of the state of South Carolina. You can get out. It's not easy. But you would have to make that 4-year commitment. It is, ethically, it would be the right thing to do. I would point out, though, that we have been with Cigna since 2014. There's a learning curve. Employees would have to learn to maneuver within a new network, and that's the Blue Cross Blue Shield network. It is a very wide network, I would say, though. Employees would have to meet a deductible prior to the copay for office visits. But again, the county is looking at ways to overcome that. And would that be a possibility? That's something that's certainly out for discussion and certainly something I've built into my numbers. There's a non-embedded pharmacy deductible. So in other words, your pharmacy deductible is outside of your major medical deductible, but your co-insurances on your pharmacy may be a bit lower. And then there may be potential changes to retiree dependence costs and those with less than 100% premium coverage for retirees. Not saying that that's something that would change, but just saying that that's one of the things that I saw as a potential con as we tried to address this. But I have allocated appropriately in the numbers that I've presented. So there are some administrative requirements as well, but these would be addressed by the employer and really wouldn't have any impact on the employee or the retiree. The next slide, please. At that, let me see, I would turn it over to the administrator.
So good afternoon, everyone. I appreciate you taking the time to look at this presentation of information. The main thing I really wanted to share with everyone, I've certainly said this in the last meeting that we had and heard some comments that I had not previously been aware of. And so I'll kind of speak to those here in case some of you have heard some of these same things. But what I shared with the group was that no decisions have been made related to healthcare. This process started, as you probably heard earlier, because I wanted to get input from retirees, employees, and folks that were on the plan as we looked at trying to figure out how we could balance potential changes that may need to be made to the plan in order for us to attack things such as looking at increased wages. And so the Human Resources Department started along this process to help provide me feedback and input directly from the men and women like you who are joining this call, because I wanted to hear your voices. I wanted you all to participate and help give us some direction as to how you looked at this issue from your own perspective. And we wanted to consider that each individual person in their own right contributing input to this process. So if someone tells you that this decision has already been made, that person is being dishonest with you. This decision has not been made. The council has not considered this. This has not been taken to the council. And we didn't even know exactly what we're taking to the council because we hadn't had input yet from all the parties and discussed it. So I think that's very important to tell you, because I, as your county administrator, have talked about how important it is for me to get input and feedback from the members in our community. Specifically in this community would be employees and retirees who are on our plan. So I hope that you take that seriously. I hope that you participated in this process. And I hope that you also do your homework on the information that's being provided, as well as other options that you may know about that maybe we don't currently know about. So again, I want to encourage you to take an active role in your healthcare in this potential decision that could affect your healthcare, so that we have good information and good feedback. So again, I want to just emphasize that, and I don't know, I'm trying not to be negative about it, but if people are telling you the decision has already been made, that's a very disingenuous comment, and it's not true. And unfortunately, those how rumors get started, and people don't have confidence in what's happening. So that would be a real shame if that happens in this process, because I'm asking for your input and feedback. And I'm hoping that people don't prevent you from providing that input and feedback because they're discouraging you to make comments and share your input because you feel like a decision has already been made, whether that decision is to stay with Cigna, to move to another provider, or any such related decision. The bottom line is none of those things have been taken before council. No documents have been drawn up. No recommendations have been made by the administrator to anyone related to this plan. And so we are currently in that process, and this is part of that process. So please, again, we encourage you to participate, give feedback and input, ask questions, do your homework, review the information, or review how it might be something that you see could impact you and what ways it might, so that you can better understand how you might provide input. So again, thank you all for your time. I turn it back over right now to the HR group to entertain any questions that may be coming forward. So thank you all again for your participation and for your future comments and questions.
Okay, we have a question from Mr. Wharton. Mr. Wharton, you are able to ask your question or make your statement.
Can y'all hear me?
Yes.
Hello? Okay,
Yes, sir.
fantastic. Afternoon. So as an employee with the Richland County Solicitor's Office, for the county as a whole, I can appreciate the advantages of having these conversations, aimed towards promoting trust. I mean, project impact. I believe that the intentions are well. It's just hard to really kind of pinpoint how to promote that trust, right? And I mean, these being meetings, respectfully, yesterday, I kind of heard how it was going, and it sounded a little bit more, like a lecture. And unfortunately, that's how things of this nature can come across. We need to be educated, and information needs to be given to us. And then, we state our grievances, comments, questions, and concerns. But I think and my comment and really question is multifaceted, and it's aimed towards the process, right? I personally don't believe that the decision has been made. And obviously, however, it seems that a front runner has been identified, right? And there was mention earlier from Mr. White or Mr. Hanna rather, about a number of competing companies, right, with different options. For the sake of time, obviously, we don't need to know about all the options available to whoever's making these decisions. But I think that it might be helpful and important to us to know that, these options, A, they're still just options, and B, they're not, cut off. Like an option in the competitive market is, from our point of view, these people are trying to get the contract for the state, right? Is there a timeline for these changes? Like, are we talking fiscal years? Are we talking about enough time for y'all to collect and review our input before change, right? We hear this phrase, and more so, is there enough time to respond with a counter offer, right? You guys take into our grievances and hear, my big question really is mostly a vision plan and about kind of the conversation of copay. I also understand that, and while we all do, we hear 8.25 millions possible savings in the first year. That's a large amount of dollar signs. So is 9.7 million deficit over 8 years. But that's the thing, is that's over 8 years. That's like what, 1.2 million a year. If we're aiming, or if it's in the future for 8.25 mil to come back in the first year, it kind of feels like not that we're choosing, but that the front runners been identified because it's the quickest return on investment, perhaps, or could be viewed in that light, as opposed to another option or two that might not be such a substantial return immediately, but over a period of time. Also that's going right into 25% of people when you haven't worked for the county 0 to 5 years. What's the age range of that? We're talking if that age range is aging, as was referred to when talking about who seeks care more frequently or not. That's important numbers to realize when we start talking about, or at least having the conversation, right? And that's what I'm trying to promote, is have this conversation about how to keep that number a little bit more stable, because it's fragile, right? Especially if that group is young, 0 to 5 years. What's going to keep that number stable enough and sustainable enough to increase the 5 to 10 years or the 10 to 15? And that goes into retirement. But really, I'm just sort of trying to get a good grasp on the procedural timeline. Like, what are we talking here?
Yeah, I'll address that as the administrator. So I think earlier in the presentation, I think maybe even later on in the presentation as well, Ms. Walker had talked about how the county has gone out continuously to seek other providers and get competitive procurement processes as well, to see whether or not they would be able or interested to provide health services to Richland County over the course of the last several years. And I think we talked about providers who were not interested because of the cost that they would take on the lives of Richland County. And so some of those, I guess you would say, plans have already been viewed and certainly can be reshared. But those plans that were viewed and were, as you kind of identified here, may not be looked at as front runners simply because they were not a better option than the two options that you're looking at financially. But I do think there's value in resharing that information. I do want everybody to look at that and get a real good understanding for what we're trying to share with you. Because again, literally there's no decision that has been made. This information was shared last year, so there's no specific timeline. They're simply trying to go through a process so that when we get to the conversation with county council, we feel confident that we have looked at a number of options. We have had a number of discussions, public dialogue, and that whatever council decides to do with this potential matter has had a lot of feedback and input. So there is no specific timeline associated with, we have to do this on this date and time, because that, again, there's no decision that's been made to make that.
Right. Well, I can appreciate that. Just kind of want to promote, I'm all for the transparency, but it's one thing to be transparent about the information, but it's another thing to really include the people into the conversation proactively, right, as opposed to reactively. And really just my last one question, that might be on other people's mind, but this not being proposed to council members yet or taken to them, or however, is it whose plan are they on, or how would this affect their health coverage as well?
Yeah, so that's a little bit of a personal question, because I'm not even sure if all the employees that are Richland County are on Richland County's plan. Not every employee for Richland County to take the plan. Some people choose to be on it, some don't. And I don't know if all the council members are on it or not, or a combination. I do know we have some council members who are on the plan because they were on the call on yesterday, ask questions about, the plan and what it would be like for them to go to another plan. So I can say with certainty that there's at least one council member on our plan, but I can't tell you whether or not, all employees of Richland County are on Richland County's plan.
Mr. Brown, this is Dwight. Just to add to what you say and hopefully provide some clarification, the county only has one plan. We don't have a separate plan for council members, or a separate plan for the HR department, or a separate plan for the administrator's office. So if whether it's a council member or Mr. Brown or me decides to enroll on the county's plan, it would be the same plan that all employees are on. It would be the same plan. We don't have a executive plan or a council plan or any separate plan. There's only one plan. As it relates to options and I guess the aging population, I'll touch on that. Since I've been with the county and Ms. Walker went over this, I think, and I'm talking off the top of my head, I think we have gone out for RFPs at least 4 or 5 times. And each year, even when we don't do an RFP, we do not just accept what the insurance company proposes. We vigorously negotiate, push back, argue, whatever you might want to call it, with them. And I think the fact that Cigna is about $9 million in the hole over the past several years will illustrate we're not just rolling over and accepting whatever the insurance company proposes. So we have, I would say, leveraged competition to the max, I would say. In addition, we have had a neutral professional insurance consulting firm, Gallagher, to evaluate our renewal that we negotiated with the Cigna after we did, and they were not able to negotiate a better renewal. So we are very aggressive about renewals, even when we're not doing an RFP, and also being competitive when we're doing an RFP. Thank you.
And thank you. No, I certainly appreciate y'all's answers, and I don't doubt that you guys are advocating for those who are ultimately going to be affected by these changes. You know, as that's my point. You know, as long as we have these meetings and it turns into, okay, we can be heard. You know, I mean, that's why we have these meetings. I won't take up any more time. Let other people have their questions and concerns. I certainly appreciate y'all's responses, and I certainly look forward to hearing about any more developments in this for sure.
And I'll just add one thing. One of the things that's been important to me is to be transparent with employees and retirees about what we're doing. I mean, I worked with the county since 1998, so a lot of the retirees, at some point in time, I worked with them. I know many of the employees, and I'll never forget when I told Ms. Thomas, Assistant County Administrator Thomas, that transparency was important to me. I never forget the first thing she said is, "I'm so glad to hear you say that." And never has Ms. Thomas or Mr. Brown said anything about don't say this, don't share that, don't do this. Never has that been the case. So this, I assure you, this is a transparent process. And if you have a chance, everyone on the call, please go to the intranet and look at the information. I think you will see there is a wealth of information about PIBA, about the county's plan, about presentations. I assure you, well, I feel confident you will feel better about the transparency if you just go and look at the amount of information we have put there for employees and retirees. Thank you.
Thank you.
Thank you very much. We have another question or comment, and Ms. Barber, you are able to speak.
Yes, I have two questions. My number one question, one of my questions is, you said 9.7 million claims were made. How many employees are in Richland County and how many retirees? I'm just curious. And then I have another question after you answer that. Hello?
I believe that the information was there's been a $9.7 million loss by Cigna, not $9.7 million claims.
Okay, well that's fine. But how many employees are there?
There are about 1,750, 1,800 employees right now. It breaks down and it moves a little bit with part-times.
Right.
Right now we have 1,600, or at the time I got this data, which might have been a month or so ago, there were 1,613 on our active plan. On the retiree plans, there were, just one second, let me get to that page, 108 early retirees, that being under 65, and 252 over 65 that are on our plan.
Okay, thank you. I was just curious. And here's my other question. Y'all have given us a lot of information today in an hour, and I know there's a lot out there on the internet, as Mr. Hannah was talking about, that we can go look at. And because I'll be honest with you, after yesterday's meeting, there was a lot of talk going around. Are y'all gonna come back around to employees and ask them again what their thoughts are about going to the state plan, or is it just going to be y'all going to make a decision? It's going to be a done deal.
So I'll try to answer that question. And I guess I really probably have another question myself. So it's not going to be a done deal because there is no done deal. I'm not trying to be facetious when I say that, but it really pains me because it sounds like folks are not taking this seriously enough to understand that when I asked for the staff that I oversee to go out and get input, that's exactly what I asked them to do. I'm not trying to be funny when I say this. It's not designed to be that way. I have worked for companies, both private and public, where decisions are made because the company has control over benefits. Benefits are in few cases are not things that are required by law. So companies have benefits as a part of their compensation package. And as a part of that, the companies decide what packages they offer, what packages they don't offer. And oftentimes, in very few instances, which is why I do what I do, as a matter of fact, have I had a provider ask the employees what we wanted, what we thought. But I thought growing up in the business that I worked for, that's not what I thought was good. And I thought it would be great if the employer actually asked for input from the employees. And so that's exactly what I've done. And certainly what we've done also is we've tried to highlight some information that was brought to our attention so that you would have a better insight on some of these things to really take a deep dive. But, you know, in terms of how many times we may come back around, I guess my question would be, you know, what would be the appropriate number of times for people to then feel like they've given input and that we've heard everybody? Because my understanding is that we've had a number of these meetings. People have had an opportunity. We're having meetings now. We don't know how many more we're going to have, but we're trying to provide those opportunities. So, you know, I don't know what the magic number is, but can someone tell us, you know, is it 3 meetings? Is it 5 meetings? Is it, you know, how many times do we have to engage to let people know that we are asking for your input and we wanted it the first time and the second time and every time that we've asked for it?
Oh, I understand. I do appreciate y'all having this meeting, and I don't know the number of times, and maybe there isn't. I mean, it was just a lot of information to look at today, you know, within an hour.
Sure.
I know there's a lot more out there.
Yes, ma'am.
On the internet.
I do not expect, and that's why listen, this is not going to be a situation where Mr. Hanna is going to give me a report, say, hey, you know what, we had 6 meetings and, you know, we did what we had to do to meet the quota. So now let's go ahead and make a decision. It's not like that. This is not something that we're taking lightly. It is very serious. As a matter of fact, I think I shared a statement with Mr. Hanna that talked about the significance of this type of discussion and this type of issue for all of the employees in Richland County. So that's really sincere. That's not something taken lightly. So I'm just really encouraging everyone to take the time, review the information, and provide feedback, and just be genuine. Don't participate in the meeting and talk about the information at a future date if you never take the time to actually dig into and you just listen to things that people are saying and just take that for face value. So I'll just ask everybody to please participate, and no decision will be made without there being a conversation about, hey, we're getting ready to make this decision, that you will know well in advance. And again, regardless of what the administrator does, always remember there's a public process that has to take place with county council. So it has to be discussed in county council. And I guarantee you, they're not going to take any action on this after 1 meeting. I just don't feel that way. And I would not expect them to, nor would I present information to them of this magnitude with that being the understanding. So just try to take confidence in that, but watch it play out, and then you'll be able to see that I'm a man of my word.
Okay, thank you very much.
Thank you.
Thank you very much. The next question is from Ms. Nellermo. You are allowed to talk.
Good afternoon. Can y'all hear me?
Yes, ma'am.
Okay. I have 2 questions. The first is the surveys that y'all were discussing at the beginning of the presentation. How much weight in your decision making is put into those surveys? Because I know I wasn't given a survey and I don't know of anyone else who took part in the survey. So I'm curious what weight those surveys had and where they came from.
So to the question that came before yours, the survey came out of some of the discussions that were had. And as I understand it, there was discussions that were had in previous impact meetings And then the survey was sent out after that. And I know HR has all the details of that. So I won't comment further on that. I'll let them provide that. But in terms of the weight, everything is information. So let's use the numbers that the Assistant County Administrator mentioned earlier. She said we had roughly about 1,700 employees. So we know that not all 1,700 employees participated in the survey. Why? Now that I cannot answer for you. But we know that there's more than the 300 and however plus or 400 plus people that participated. So it's just information based off of the numbers that we received. So there's no criteria that's saying we're weighting that as if it applies to all employees. That's not it at all. What it is doing, though, it is showing that we were having a conversation and we attempted to get some feedback. And of the feedback that we received, here's what it looks like. That's all it is information. Just like you're having the opportunity to share your information today and potentially in the future, it's just another piece of information.
Okay, thank you.
As it relates to the survey, and I'll let Ms. Walker chime in because she really spearheaded this part of the process. I think an email was sent out to all employees to their county email, but I'll let Ms. Walker speak to that specifically.
That is correct, Mr. Hanna. We sent out the survey, I want to say we sent it out 2 or 3 times to the all Richland County employee email addresses group, as well as we asked for our HR contacts to partner with us to ensure their employees were informed about the survey so that participation could be granted.
Okay, thank you. And my other comment / question is before I worked in this county, I worked in a different county and we had the state health plan and under PIBA. But with that, there was the premiums were higher, the co-pays were higher, it's a higher deductible, and I think everyone is concerned about that. I understand there's more information out there and it would be different for every person, but it just kind of seems to me like, the county's trying to save money and it's going to be pushed on, to us, to make up for that with going to this other plan.
I'll speak to that, and maybe Ms. Thomas might want to speak to that as well. As it relates, well, let's see. We have gathered hundreds of pages of information from PIBA to look at. Part of that information includes the premiums that are published by PIBA. That information is also on the on our intranet site. It's PIBA's information. We just have a link to the PIBA. I think it's about 200 pages, but it's in there. We could easily highlight it. Be glad to send it to you or anyone else. In just talking about the premiums, and I'm going to talk about premiums and out-of-pocket separately. In talking about the premiums in comparison to our current premiums, generally speaking, the premiums are significantly less. I'm only talking about the premiums right now. Would be significantly less. There would be less for the county. There'd be less for employees, generally speaking, as it relates to premiums. Now to go to the what's commonly called out-of-pocket costs, such as office visit, copay, deductibles, co-insurance, things like that. We, the county, had an external company, Gallagher, to do an objective third-party analysis comparison of the PIBA plan to the county's plan. That information is also available. I think it was in the third impact meeting in detail be glad to mail it to you so you won't have to go and email it to you where you won't have to dig it out. But in summary, and I think Ms. Thomas was talking about this earlier today, the short answer is if you compare the county's plan to PIBA's plan, yes, there would be some additional out-of-pocket expenses greater than the county's current plan. I think, I'm not talking for Ms. Thomas, I think Ms. Thomas was also talking about some budget provisions she'd worked in if it's permissible by PIBA to where some of those, maybe not everything, could be covered. But to your point, yes, as it relates to some of the out-of-pocket, there would be different, or employees would pay more, for example, an office visit compared to now. And I'll stop there, and Ms. Thomas may want to say something, or she may want to correct what I said if I didn't speak correctly in what she said earlier. Thank you.
No, Dwight, you were spot on in relation to premiums. Actually, when you compare our premiums to PIBA premiums, there are only 3 classes that would be more. And if everyone remembers, in the slide that I showed, I actually calculated what it would take to make up that difference. There's nothing in PIBA restrictions that would require us not to do that. And so we would be able to, in what I have proposed or shown earlier, that there would be no premium increase if we were to go to PIBA from where we are currently. I can't say that with Cigna because we don't know what those premiums are going to be, and we don't know how those will be allocated because they are losing money. Not saying that PIBA is where we're going. I'm just trying to point that out, is that you are not guaranteed the premiums that you have outside of the current plan year. You're not out, and to be fair, health insurance plans change in employers regularly. I was with an employer, and it was another governmental entity, and ours changed on average sometimes twice a year because we were self-funded and we had to balance the budget. So I will point that out. With regard to out-of-pocket costs, I would say, yes, there's the potential for that. However, if you also recall in that, I did point out that we had looked at what the cost of covering the deductibles for standard coverage would be, because there's only 2 deductibles for even family coverage in the state health plan. Not saying that's where we're going, but I'm saying that I had built that into the slide as well. And you might want to go back and take a look at those calculations. I believe they're actually indicated on the slides. With regards to other potential costs, what I would also point out is, granted, there are some people that you know that you're going to spend it, but if you take the premium savings, if we were to go to PIBA and put those into an FSA, you would have money to be able to cover those additional costs without costing any more than you're currently paying. But you have that option. That's an option. And if you don't spend it and you just have it come into your paycheck, well, then you've increased your maximum take-home pay. Any questions on that, or would you like, did that answer your question?
Yeah, I think y'all covered it. Thank you for addressing that.
Yeah, thank you all. And that was a good question. And I'll mention something that I did mention on yesterday. And we can certainly continue to focus on questions about PIBA. I totally understand why you might want to do that, but please don't feel obligated because, again, there's no decision that has been made to go to PIBA. You may have questions about what happens if we stay with Cigna. What happens if we are not able to stay with Cigna because Cigna decides that they no longer want to cover Richland County at the rates, or that they don't want to, there may be like another provider and they don't want to bid on Richland County. You know, those are all discussions that none of that stuff has been finalized. We don't know at this point whether or not what our future costs will be. That comes some later time. So that we're going to want to share that information with you as well. So again, nothing has been decided. This is all a big information pool for you as well as for us as we look to try to address, healthcare for the fiscal year 2023 in the county's budget.
Thank you very much. We have another question. Mr. Wharton has another question or comment. You are now able to speak.
I appreciate it. I raised my hand when Mr. Brown posed the question to us, how many surveys or how many meetings? And I think it's not an easy solution, but a solution is just the timeliness. Right? I mean, I can't speak for the developments of these. I just checked my Richland County government email to see if I had mistakenly received any, surveys or something to that nature after Ms. Noah was speaking, and I couldn't see anything from HR apart from a newsletter since we had health screenings back in September. And so maybe just apart from that, just what's kind of question? What's the next step? What's the next round of information after these meetings? After talking with us, kind of hearing that. I mean, generally, what I've heard is that copays are nice, right? It'd be nice to have some sort of, I mean, obviously nothing's concrete, but maybe just have a little bit more of a grasp on that whole narrative. And also, I didn't see vision costs or dental costs in those top 5 or 6 areas that the county was allocating those, or I guess the claims rather. So I was kind of wondering how the staple, I mean, listen, I'm talking, I got glasses, I see 2 other people with glasses. I know people are checking, dentists aren't the most enjoyable times, but still like 2, we have employees who have family members who do have PIPA plans, and something that concerns a lot of us is that PIPA basic might not cover 2 cleanings. If there's any way that we could get some clarity on that, I mean, it's just sort of when we hear stuff like that, a lot of the good that's come out of the transparency, it's like, okay, well, at the end of the day, some of these might actually be hidden negatives, and I mean, I like how this is going. And listen, I think you're being as sincere as humanly possible, Mr. Brown. I mean, I don't know if you're elected. I know that the council members are, so I can see how our feelings and our desires play into y'all's as well, at least the people that are going to be having these conversations and making these decisions. And I think that's sincere. I don't think that we're all corrupt politicians in that respect. I think that it's just hard to get across the interests of those who are represented. So about the timeliness of information, that kind of would be my suggestion into scheduling more talks or communicating information in that regard. You see what I'm saying? Really, my only other concerns are those other staple coverage plans that I didn't really hear much about, being vision and dental. Because I mean, and also as Assistant Solicitor Gaston so eloquently put it yesterday, I mean, working for the state, it's not as desirable as other sectors. I mean, I can say that I've been here for 8 months. Personally, I love it. I don't want to be an employee that's 0 to 5. You know what I'm saying? I'm liking how it's looking for a 5 to 10, but I don't know how I can communicate that to somebody else my age if the honey that is dripping all over being employed with the state, furthermore the county, of good benefits. I mean, the pay for the state, I mean, that's a whole nother conversation, but I mean, comparable to a private attorney, what's the difference? They get paid more for doing other things. We get paid well, but still we have good benefits, supplemental, so that's another conversation to take to those council members, or, to factor into y'all's decisions. Is, it's an important thing that not only that we have trust in those who hold these meetings and who are here talking to us today, but also confidence in the institutions that we don't see, you know. Thank you again.
Yeah, so,
As it,
oh, go ahead, Mr. Hannah. I'll go ahead, sir.
oh, okay. As it relates to the emails, those of you who said that you did not receive the emails, we'll follow up with, we'll check the emails that we sent out and follow up with you directly on that. As it relates to dental and vision, the information is in the I.M.P.A.C.T plan, and the information for the county's dental and vision plan is also on the internet. We chose to focus, again, it's just with the health insurance, it's a lot of information, and we chose to focus on the health insurance because that's the most expensive benefit and commonly recognized as being the most important benefit, whether it's employees, retirees, or applicants or whatever. But we did not, I guess, overlook or not consider reviewing dental, vision, and life insurance as well. And all the information for that is on the internet. And we'll be glad to, share it to you, email it with you if you can't easily find it.
Just to clarify, are we talking about maybe somebody can verify PIBA.sc.gov?
I don't know the PIBA's website
Okay.
offhand, but we already have the information on the internet. But there is a website you can go to, and we will publish that if we don't already have the link. So you could go directly to PIBA's website and get, look at whatever you want directly from PIBA. Because again, we're not trying to take PIBA's information and massage it in any way. We just posted the information that we looked at. But there is information about the dental and the vision for PIBA on our internet, and you can go to their website and look at it directly from them. And there's also information about the county's vision, dental, life insurance. PIBA does have a dental plan. They do have a vision plan from memory, and they do offer life insurance as well from memory. I'm not a PIBA expert, but I've probably read 400 or 500 pages of PIBA information. So again, I encourage you just to look at it, and you're welcome to go directly to their site, because again, we're not trying to massage anything or cut out anything.
Yeah, just trying to at least check to see if any of those comparisons between other plans, not just health insurance, but also vision and dental. But I mean, it is available. That covers my issue, I guess. So the only point was the timeliness of communication between us to y'all, and then y'all to whoever, and whoever back to y'all and back to us.
Yeah, I'll speak out and say that I know that the invitation for the survey was sent out. I believe it was the week of December 18th. It was 2 weeks before Christmas.
Okay.
It was sent out, and it did go to all employees. So you may want to actually ask.
You got muted, Lori.
Ms. Thomas, you went mute.
Sorry about that. If you're in an area with a secure server, you may want to ask your IT your IT contact if they're if any of the mass emails are being blocked.
I got you. No, thank you. I appreciate that, Cliff. I mean, I wasn't too worried about that. I just wanted to kind of.
I'll also say too that from a cost perspective, the vision and the dental are very similar, both with dental, the regular dental and the dental plus, but I've got some cost data, but as far as the plan comparisons, I can pull something together. But as Mr. Hannah said, it's all out on the website. And, dental is pretty much, you're only going to pay a certain amount every year to a maximum.
All right.
And pretty much the same with vision, unless, and even on a buy-up type plan, you're only going to get certain care and certain contributions toward glasses and such.
True. I mean, I think that after these meetings, people will have an eye out, for any other information. So, I mean, something coming across, and I hate to say, in hindsight, but after a meeting and talking as we have, and really the whole office has between today and yesterday, I think that any other follow-up surveys would be taken with we kept a closer eye on, rather.
Yeah, there was a question that you asked, and I just wanted to provide a little context. The first meeting that we had was an in-person meeting, and I recall were a group of gentlemen who asked a question as to why did we not make this decision last year when we were looking at cost structures for health plans, and there were multiple scenarios that came out. And one of the things I said at that meeting was that, some people look at it as, it's a pure money-driven decision. And I said, however, it's a group health plan. I said, and there are things about the health plan that you may not value that someone else may value. There
Right.
that may be consistent for you that others might see are unnecessary. So we had that conversation, and from there, we have all of what we've done up until this point. And I'm just saying that to you to highlight that's another indication that this is not about a decision that has a timestamp on it, more so than it is about a process by which we become more educated as a community of healthcare recipients as to how our healthcare plan is constructed and the costs that are associated with it, and what that may mean for the future of our healthcare plan and healthcare options. So again, I want to emphasize that I'm glad to hear that there have been a number of folks over the last couple of days who said they really enjoy their plan as currently constructed. And hopefully some of the information that was shared with you also indicates to you how when our HR department has had to strenuously negotiate with providers to stave off cost, that they've been able to do that. But maybe some of that visibility that you were able to see now shows you that potentially it may be coming to the end of their rope and being able to do that. And what that may mean in order for us to keep that plan. So there's really a lot that goes into this, and there's a lot to be considered. So just don't just look at PIBA as the county's moving to PIBA. Look at the county looking at health plans, and if the majority of the employees want to keep, for example, let's just say that all the employees said we want to keep Cigna. Does it also equate to all the employees want to keep Cigna at whatever cost that it would take for you to keep Cigna? Those are also questions that you have to be considering. So, because those are not questions that I can answer for you, but I can certainly tell you whether or not Cigna says, well, here's what it costs to have our plan, and then here's what those costs look like now for you as an employee.
I see. I mean, you got to trust the process at the least.
Yeah. So, well, good questions, though. But thank you very much.
No, I appreciate it.
All right, the next question we have is from Oscar. Oscar, you're allowed to speak. Ask your question or comment.
Hello. I just had a quick question in regards to the survey that was sent out. I don't know if I remember the specific question word for word, but there was one item on the survey that was of most concern for me. It mentioned about the possibility of switching plans and something like the decrease of benefits with a possible chance of pay increase. And then the only other option was maintaining the same benefits and raising the cost. I believe that's what it was. It's been a while, so it's hard to remember exactly. But being someone who basically their focus in school was analyzing information, seeing something like possible pay raise doesn't seem like a probable pay raise. It makes it seem like it could happen, but the likelihood of getting a pay raise with the reduction in benefits isn't high. Is there anyone that could kind of speak to that? Because I wouldn't want decrease in my benefits with a possible minimal raise if the costs aren't going to offset each other.
Right.
I'll
So
speak to that.
you sure, Mr. Hannah, because that might,
Well, let me start and
okay.
yeah, let me start.
Okay.
As it relates to the survey, the HR department is responsible for the survey and the wording of the questions. And that's one reason I wanted to speak first, Mr. Brown, because we did the survey. We in HR did not want to commit or promise there would be a pay increase, because that would be something that's beyond my pay grade. Possibly at least would have to be approved by the county administrator and maybe even the county council. So I do understand your concerns about the way it was worded, but that was in an effort not to promise something that had not been approved by the county administrator and or the county council. I guess I grew up in the country and we would say, I didn't want to outrun my headlights, so to speak, and get ahead of myself and promise something that we, at least in HR, as the director of HR, I cannot approve budget increases or things like that. So if the wording was poor, we had to take the responsibility in HR, but it was an effort just not to overpromise something. Thank you.
And thank you for that clarification, Mr. Hannah. And I'll speak to that more specifically from an administrator standpoint. So thank you for that clarification. When I talked about the whole process that we are starting, that started back, and I can't remember when it started, but it was certainly sometime in 2020. One of the things I verbalized at the time was that we are looking to provide a balance. And first of all, let me just say to all of the employees that are currently listening to this call or that will see this later on because it'll be recorded and available to be viewed, is thank you for your service to Richland County and thank you for being with us. And I take that and say that with all sincerity and no light measure. And one of the things that I've heard many times when employees, at least where departments are telling me and managers are telling me, and there are exit surveys that people are leaving Richland County, those persons generally are saying, hey, we're going to a better pay. We're going to a better pay. These retirement and these long-term issues that you are communicating as positivities, that's not doing anything for my bottom line, and we need more money in our pocket. And so in trying to deal with how do we get more money in your pocket with utilizing the general same pool of funds that we have to work from is where that balance that I talked about trying to strike. How do we have a good health plan that provides the needs that for the community of employees, but at the same time that we can then also provide them with pay that, so they're not looking at us as saying, why can't I get, paid? So to Mr. Hannah's point, we certainly need the county council to approve anything that we do, but the idea would absolutely be to only use the funds that are currently being used for benefits for compensation related benefits. So the way you would spend the money still stays within the employees receiving the benefits. So, I certainly can't guarantee anything for anyone at any time, but that would be that the benefits funding stays within benefits to include compensation by way of pay. So that would be how I would, if the county council decided that they were in any way, shape, form interested, and if employees felt like they wanted to consider this, it would be a combo package. It would not be, we're going to reduce your benefits and, hope for the best. That is not it at all. That would not be something I would recommend as a county administrator, nor is something am I considering at this point in time at all. It's just a reduction of benefits for the sake of reduction of benefits. So I hope that answers your question.
All right, we have another question. Ms. Rosenthal. you are allowed to talk and you can speak your question or comment.
Thank you. I more have a comment versus a question. And my comment is, first of all, thank you, Mr. Hanna, and your team for putting all of this together. I have never worked for any entity, whether it be in the private sector or governmental, federal, state, and now with the county. I've never seen them put together such an amazing presentation to let the employees see what the differences are. And it adds a lot of value to what you guys are doing and trying to educate the employees. So I wanted to say thank you. And then my other question, well, my question is, and I think you answered it, and it was, whenever I see medical, I seem to not ever put the dental and the eyes with it, with the medical portion. So I guess I'm a little confused, but I think you answered the question. You just left it out, but it is on the intranet. Did I understand that correctly?
Yes, you did. We did review the information. We did from I.M.P.A.C.T. We did capture the information, and we do have the information on the internet available, as well as the county's information on the dental and the vision and the life insurance as well. Again, it's so much information, even if we're only talking about health insurance. We were trying not to, I guess, overwhelm employees with too much information in terms of just the presentation, but it is available on the internet. And if you like, we'll be glad to email it to you, because there is a lot. If you have any trouble finding it, we can email it to you. But basically, the health insurance is by far the most expensive of the benefits when you look at dental, life, compared, or vision compared to health insurance. That is what employees, retirees, applicants normally are most interested in, but we certainly have the information available on the dental, vision, and life insurance for both Richland County and I.M.P.A.C.T. as well. And let me add one thing that hopefully gives a little context to maybe why we have talked about I.M.P.A.C.T. so much. Unless the county is going to make a change to the current plan that we have with Cigna, then basically we get the same thing. So if we don't change anything, we have pretty much the same thing, or more likely the possibility of increasing the premium. If we were with any other private insurance company, so like Blue Cross or Aetna or United Healthcare, roughly it would be the same, because the first thing they always ask is, let me see your claims for the last 2 years, 3 years, whatever amount of time. So they're all going to be looking at the same claims. So whether we're with Blue Cross or whether we're with Cigna or United Healthcare, unless we made some significant changes to our plan, we would pretty much be where we are. So we'd be showing you a comparison that wouldn't be really of that much difference, I guess it's the point I'm making, versus showing you the I.M.P.A.C.T. plan, which is more different in terms of the premium, as well as some of the other things that we've talked about. So it's not that we're not considering. I mean, last year we looked at Blue Cross as well as Aetna and asked United Healthcare, but they decided not to make an offer. So we look at all that, but if we just put them up there, they'd be very similar to what you're looking at with the Cigna, unless we made some plan changes. Thank you.
Do we have any more questions? Mr. Wharton, you can go ahead and speak.
Awesome. You mentioned it might have been Mr. Hannah or Ms. Laurie who was talking about the committees that were involved in, I believe there were 7 meetings on this topic. And that was kind of glossed over so we could get to the actual like needed information, but were those committees aimed towards figuring out like the process? Were they more so, you showed the topics. I was wondering if maybe, I mean, I know we can do this after the fact when it's available, but I was wondering what committees those included. I do have when looking for those surveys, I was able to find where I was emailed the survey. It was just not, it's just not what I was looking for. So I did receive those email surveys the week that Ms. Laurie Thomas mentioned. In the same one, I saw mention of a employee grievance committee, and it's not about focusing on hearing these. It's not about the assumption that we all have grievances and that's all we want to be heard, but I think that it'd be important to involve committees aimed towards communicating, any discrepancies and the train of thought between the employees. And I believe that they, or at least that committee, reports directly to you, Mr. Brown. So I don't know. I'm just not sure. Trying to think of different avenues to have a little bit more of an active role on the employee side. I'm not looking to join the committee, but who are they? How do we get certain groups, boots on the ground, to have a little bit more. So it's not like we have to have a 3-hour town hall meeting just to get back to the same point.
As it relates to,
Go ahead, Mr. Hannah. Go ahead.
as it relates to the, I think we're talking about at least 2 different committees. There was an impact committee, which is the group that Mr. Brown authorized HR to coordinate, and that was made up of employees, I think from about 18 departments. I think we have one of the slides was on that. Those were not handpicked by HR or Mr. Brown. Those came from employees that either volunteered to their department head, or maybe their department head volunteered them. I don't know, but it came from the department. Either the employees volunteered or they were volunteered by their department or supervisor. And I think there was about 34, 35 of those from 18 different departments. So that's that group. And there were 7 meetings, and each of them were about 2 hours each. As it relates to the grievance committee, which is a totally separate committee, employees may apply when it's advertised to participate on the grievance committee, but that is decided by the county council. That is a separate committee altogether. And I think sometimes very soon, if not presently, the council will be advertising for a couple of vacancies on the grievance committee. Thank you.
Thank you. You might be hearing a lot more from me.
No, this is the insurance call.
Okay, so we thank you all for your questions and your comments with us this afternoon. Again, our information will be available on the internet. For employees, it will be on the internet, and for retirees, there's a unique link for retirees to have access to the information. Additionally, if you find after this meeting that you still have additional questions and comments, we encourage you to please share that information with us at our benefits email, and we will respond accordingly. And again, we thank you for your time, your questions, and your considerations as we move through this process. We hope that you all have a great rest of your day and your week.